So, as Steve mentioned, the focus of this is going to be on some new federal rules, and the summary in the program mentioned that this is going to be a fundamental change. And when you say those words together, some people are going to think, wow, that's great. We really need to change because, you know what, we should probably just blow things up and start over. But then there's other people who think, whoa, 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 don't change, don't change. Everything's fine, I don't want to change. And then we've got a bunch of people in between. But anywhere on that spectrum, it's still going to cause some concerns and worries and the like, and we get that. And so hopefully today, as we go through, folks, we can kind of narrow down really what this means and what it means not only for the state, but for you, if you're a provider, a family member, someone who receives services, or whatever role you play. So to start with, though, I want to give a background on where we're at. And to do that, I want to start by kind of defining, number one, what are these things called home and community-based services? And why do we even care about federal rules to begin with? We have an entitlement in California. It's the Lanterman Act. So can't we get services? Why do we care about the federal government? As you may have heard in the past, sometimes the state finds itself a little short of money. So we have been forced to look for money in different places and a lot of times. And so we have really become quite dependent to a certain degree on federal money. Right now, about 40% of the money that is spent for regional center services comes from the federal government. So obviously then that's something that we really need to be mindful of as we work forward and in following the requirements from the federal government. So in talking about home and community-based services and when they start, I did mention that there was an entitlement. So in California, as I'm sure you all know, we're very lucky with that. But from the federal government's perspective, prior to 1981, community services were strictly had to be funded at the discretion of a state. So in California, while we were lucky that people could receive services in the community, if any state wanted federal dollars to help pay for services for people with developmental disabilities, the only place that they could receive those would be in an institution. Things like developmental centers, hospital, nursing facilities. Along in 1981, and actually prior to that, it started with a young woman named Katie Beckett and her family. Katie was hospitalized, had some pretty significant health needs, but was given the orders by the doctor, said, Katie can go home, but she needs some supports. It's going to require some services there to help her live at home. Medicaid, and again, we call that Medi-Cal in California, was not allowed to pay for services in the home at that time, even though it would have been about 6 times cheaper. The rules in place at that time didn't allow it. I know it doesn't make sense. So, believe it or not, something kind of did. There's a home and community-based services through a bunch of different vehicles. Essentially, there was a law that was changed to allow the provision of home and community-based services for people who can remain at home rather than in an institution, a hospital, or a nursing facility. So those can be provided at the state's option. Now, as I said, in California, we were doing that to a certain extent anyways, but for a lot of states, that's really the only way that people get home and community-based services is if they're getting federal funding for it. So what are those services now that we're talking about? And just so we know, we're talking about things that regional centers buy now and help support people. It could be supported living, day programs, supported employment, people living in a residential facility. Those types of services are the ones that we're speaking of. Now, I started in 1981. I'm not going to go to every year since then. I'm going to jump forward to 2014. And that's when these new rules were passed. Now and actually I want to go back a little bit first. The intent of the 1981 change to allow home and community-based services from the federal government was that these services would be different than what people receive in an institution. And I'm going to speak very broad brush now. From the federal perspective, institutional services were very regimented, not individualized, and somewhat isolating. So the intent, even from 1981, was that these services would be different. They would be, as the name suggests, community-based, not institutional-based. But there's been some concerns over the years from the federal government that maybe these services in some states aren't really being provided with that original intent. As an example, one state went to the step that we're going through now in California and closed a large, we'll call it a developmental center. When I say closed, they kind of changed the sign on the front because the next day they said this is a home and community-based setting, and they operated in the very same way. That obviously was not the intent from the federal government about how these dollars were supposed to. I know, you're shaking your head. You're saying, how can that be? And that's kind of the reason why the federal government is going, should we really have to make a rule for this? And apparently so. So what they've been struggling with and working through, when I say they, the federal government, is to make some changes and to try and define in some way what is a home and community-based setting, or what these services really ought to look like for people in the community. So that brings us to March of 2014 when these new rules or regulations were released. And what they did was define, as I said, these actually rules did a lot of things more than what we're talking about now, which is talking about where services are provided. It also set expectations for person-centered planning and a number of other things. But today we're just going to focus on where services are provided, or settings. You may have heard it referred to as that, as a settings rule. So what these rules did is they set up qualities for where services need to be provided. And I say qualities because prior efforts at trying to define where services ought to be provided really focused on what a place looked like, how big it was, how many people were there, and where it was located. These new rules, and hopefully this sounds like something that seems like a good idea, really focus on the person who's receiving services and what their outcomes are, what their experiences are, and do they, in those services, are they in a place that optimizes and encourages choice, protects people's rights to dignity and privacy, and does it provide and not prevent opportunities to engage in the community at large? I think almost everyone would agree that those things sound good. And when these rules first came out, most people were, sounds great. We've got the Lanterman Act. We said it again. That really provides the basis for a lot of those things. But then people got to thinking, what do those words really mean from the federal government? What are they getting at? So then, flash forward a few weeks or about a month after March of 2014, the federal government started issuing guidance to further define what these rules were. Part of that guidance were things they called them exploratory questions, to help people then go through and say, all right, do I really offer choice as a provider? Or if I'm a person that receives services, do I really get choices? So some of those questions had to do with, to help guide people along the way, were things like, does a person have access to food at any time they want? Can they have visitors at any time? Can they have a choice? Do they live near public transportation? And do people have opportunities for employment? Almost immediately, some people started to go, wait. I don't live anywhere near public transportation. In fact, where I live is so isolated, there is no public transportation at all. Do I have to move? People who live with other folks said, wait, visitors at any time? I can't have that. I know I can't have visitors at any time. I tried it once, but my wife didn't respond well to it. So, and access to food at any time, what about for someone that's a real health issue for? I mean, you just can't do that. You can't do it. And this is where you got to think, okay, go back to what the basic tenets was. People have to have opportunities for these things, but it's not going to doesn't mean that everybody's services or supports are going to look the same. That's completely why the federal government wanted to make these rules. Remember, painting in a broad brush, institutional services from their point of view, very regimented, people don't have control, and they're isolating. Home and community-based services should give people maximum control and maximum choices within the parameters of what meets their needs. So people may be given choices, the same opportunities for choices, but sometimes those choices may look different because of their individual situation. And as long as it's based on an individual need, that's okay. Where the federal government's going to have a concern is that we make sure that everyone has the same choice, no matter what their needs or preferences are. So again, just because people have to have opportunities for choices doesn't mean that they make the same choices. Not everyone is going to want a job. But if they do, we want to make sure that there's supports in place and that they have the opportunity to do that. Now the question then becomes, okay, so is this really going to be a big change or is it a little change? And I know the question is, or the answer you're really going to want to love to hear is, well, it depends. Why? Because it's individualized. You're going to hear a little bit later about, from Sarah, who's a provider, that the way that she's delivering services, it's not going to be a change at all. They're already doing this, and I'm sure a lot of providers are, and a lot of people who receive services are getting services in a way where they are able to exercise the choices they want, can set their own schedules, choose where they want to work and live. But in some cases, it may be a pretty big change. It may be a significant change to how that service is delivered or the way that people receive services. So and then there's going to be a lot in between. Now, one of the good things from the federal government is that they did recognize that for some states, think about the state that thought community services had a different sign, that it's going to be a really big change. So they allowed states, and are allowing states 5 years to move towards whatever it is they need to do to meet these new requirements. So one of the requirements with these new regulations was that all states had to develop what's called a transition plan, which tells the federal government, and basically tells the government where the state is as far as meeting the new requirements, what changes need to be made, and how you're going to get there. Which sounds pretty basic, should be pretty easy, but we don't have an approved transition plan by the federal government yet. And I'm sure one of your questions is, but it's been over 2 years, how come? Well, we're along with 47 other states that haven't got an approved plan yet even. And a lot of that has to do with, you think, is this a big change or a little change? It's kind of a big change in one major way. It's a change in thinking. And to really put that and define that and put that on paper has been a challenge, not for only us, but for other states. And also, I'm not sure, and actually the federal government would say this, they weren't sure what they were going to get back on these transition plans either. So they're learning along with us too. So yes, I'm kind of justifying a little bit why we're not quite there yet with this transition plan. But I think it's also a good recognition from the federal government too that, this is going to take some time. Now, I want to tell you, when we do get that transition plan finally approved by the federal government, what it's going to do and tell you and what it's not. What it's going to be is a roadmap. It's a plan. So it is, like I said, it's going to say, hey, here's where, do we have rules and policies and regulations that are in line with what the federal requirements are? And if we don't, what is our plan to address that? It's also eventually going to say, here are the number of places where people receive services and whether or not they meet these requirements, and if not, what's going to be done to get there as well. What you won't see in that plan is specifically what services are going to be eligible under these new rules. That's one of the questions that we get. Is service type A going to be provided or be eligible for federal funding? You can hear the answer again. It depends. It really, not all services, even of the same type, are created equal. It really depends on how they're delivered, how much input people who are receiving those services have into the way it's delivered, and how individualized it is. But we do recognize that and by the way, this transition plan that we're talking about, it does involve a number of other departments, not just ours, because while we're specifically talking about regional center funded services right now, a number of other folks and through Department of Healthcare Services and Department of Aging and others also receive Medicaid or Medi-Cal funding for home and community-based services as well. So that plan is not just going to be specific to regional centers. Services is going to encompass everything. So when we're talking about this change, one of the things is, and hopefully this isn't all news to everyone, but for some it is. So one of the questions is, well, how can we get involved? And because we do need the involvement of a lot. So I'm going to tell you kind of from the state level and then some things that are going on locally as well in ways that you can do that. We do have an advisory group at the state level that's working on coming up with some ideas of how we want to move forward as a state. One of some of the input from this advisory group is what I'm going to tell you in about a minute is an opportunity for funding for service providers now. We've also had some focused work groups as part of that are focusing on different important aspects of what we're going to need to do. One of it is part of outreach and getting information out. It can't only be from the state or the regional centers or service providers. There's almost 300,000 people that we serve now through the regional center system. We're going to need a lot of help in getting this out. And it's not just for providers, it's obviously about people who receive services, because any shift in how those services are delivered really ought to begin with them, with the people that receive services and their families. It shouldn't be directed from the state or from a provider or solely from those entities. Now, these meetings are open to the public. Yes, they're in Sacramento. You can participate in them by phone. That may or may not be something that excites you to do that on a state level. But certainly there's a lot of things going on locally too. Many of the regional centers have organized with their provider groups, have done some work to get together and come up with some strategies how they want to do things locally. A number of other advocacy organizations have done some things to get people together to come up with ideas. We're talking with and need advice and input from everyone. Because again, we don't, as a state, at the state level, don't know everything and don't pretend to want to say that, hey, we know best how to do this. So how else are we getting input? So I mentioned as one of the work groups in this advisory group that there was a thought that there may need to be some money involved if we're going to make some changes, meaning that providers may need to, if they really want to make some changes but can't, can we help fund that? So we were lucky enough with the budget that was passed in effective July 1st that there's $15 million now available for providers to submit proposals to help them meet or move forward these new federal requirements. Now, $15 million may sound like a lot of money, and it is, but in reality, is it going to be enough? Probably not, but we don't know. I see some head shaking, I get it. But I also want to think that we're lucky to have $15 million now without being, because if you imagine that when I go and talk to folks that say, you want money? Well, how much do you need? I don't know. Can we start with 15? Most of the time the answer is you got to be kidding. Give me some information. Let's see what it's all about. We're very lucky to have $15 million. And actually just earlier this week was talking with a woman who travels to many of the different states and has given trainings on this and said that we're the first state that she's heard of that actually had some money available for this type of transition. So I know it's only $15 million, but how can it possibly get to be more? When we talked about information and really what's needed, what we're going to be asking for people who are interested in using some of this $15 million is to submit proposals. The proposals do not have to be lengthy. In fact, we really kind of put a limit on it to say no more than 3 pages. Just describe where you're at, meaning what's preventing you right now from meeting a requirement, and what you could do. When I say you, I'm talking as providers, what a provider could do to make some changes and about how much money it would cost. That's really what we want from this, because that's also going to help us learn to kind of get a better idea about not only one, what's needed, but we want to get some ideas about what changes are being suggested. Because this is, while it can be scary that we're talking about right now, about some changes, it's also a great opportunity. I don't really like to say that I've been doing this for more than 30 years, but I think that also gives me the benefit of saying I'm kind of glad we're not doing things the same way we did 30 years ago. We've moved incrementally forward. Sometimes we've taken some steps back, but we're kind of being nudged again. This is an opportunity for people to really come up with some creative ideas about how we think services ought to be delivered. And just like I said earlier, it should not be driven just from the provider. It really needs to be in conjunction with the people that are receiving those services about if they had their dream, and that's what I always used to say, okay, in a perfect world, what would it look like? And that's really what we ought to start with. Don't think about the barriers right now. If there are some barriers, write them down, because we may need to address those in the future. But in that perfect world, what would it look like for the people that are receiving services? So other ways to give input too, like I said, we not only do we have these advisory group meetings, which happen roughly 3 to 4 times a year. We have a dedicated email box for this as well, and we can make sure you get that out. I think it's in our contact information, but if not, I'll make sure it is. There'll be a formal public input policy. I talked about the transition plan that's going to be developed. It should be, the next draft of that should be available, and it'll be available through the Department of Healthcare Services, but still we'll have a link to it on our website. That should be in about the next month or so. But any way that you can want to be involved, and it doesn't have to be through these formal ways. You can work through my contact information as well. We really do need a lot of people, not only to get ideas about what we need to do, but to help share what's going on with people. Because everyone needs to know what's going on. And we don't want this to catch somebody by surprise one day. So what I want to do now, and so that's kind of the state level and setting the background, and I want to turn it over to Janis White, who's going to talk from a regional center level, working more directly with service providers and the people who we serve, kind of tell you what's going on there too.
Thank you, Jim. When Jim Knight says I'm from the state and I'm here to help you, he really does mean it, and we do appreciate all his support. From a regional center point of view, there are 21 regional centers in the state of California, and we are all funded by the Department of Developmental Services. So as they're getting the federal funds, it's our job to make sure that we are able to implement those new rules, and so that we can get those funds and provide the services that people need. Jim has kind of alluded to this already. In some cases, this is going to be a very different change of mindset. And so our job is to move away from what a setting isn't a place. A setting is, what does a person want and need? And how do we meet those needs of that person? And so I'm just going to briefly talk about what Jim has already mentioned. It has to be person-centered. I know this is not a new concept, but we seem to have somehow gotten away from it a little bit. And we need to look at, where does a person live and where does a person work? Those are some of the most important parts of all of our lives. And so we're going to address and how that is changing. So Jim talked about settings, and Jim talked about the fact that he's been in this business 30 years. Well, okay, here's an admission. I started teaching over 40 years ago. And so I remember when IDEA, Individuals with Disabilities Education Act, thank you, I hear you helping me, went into effect in 1975. I was in New Hampshire. I was a speech therapist in the public schools. And when that went into effect, we started assessing students that weren't even allowed to go to school with their brothers and their sisters and their neighbors. And now these students could start coming into the public schools. That's what I think about when I think about these CMS new rules. People are allowed to come into the public just as they were in the school system over 40 years ago. Americans with Disabilities Act. I know this morning Andy talked about the American Disabilities Act and how he was there when when it was signed. This is the same thing. People are allowed to be integrated when they didn't really have those options as much as they do now. So as you look at all the different settings, integration is a big one. We're looking at the typical population. Privacy in your own room. If someone's in a group home, people just barge in. It's like, what about knocking at the door? What a novel thought, to have some privacy, to have independence in making your decisions, freedom of dignity, respect, freedom from coercion and restraint. This is what the whole thing is talking about. As you look at the person-centered planning process, and as I said, this is not new. We've always tried to put the person first in the regional center system, and I won't ask anybody to raise their hand if they're from the regional center system. There might be questions afterwards, and you may not want to self-disclose, but in the regional center system, we kind of say an individual program plan is synonymous with a person-centered plan, but it seems like as caseloads have gotten higher and we've had to have a lot of paperwork, somehow we've been a little focused on the paperwork, and we need to spend more time with the person. And so people say, well, there's 21 regional centers and 21 different ways of doing things, but I have to let you know that we all meet together at least quarterly. The consumer services side meets quarterly. The community services side meets quarterly. The executive directors meet at least 5 times a year. And we are all trying to work together and not reinvent different ways of doing things. So I've quoted Mary Beth Lepkowski here from Tri-Counties Regional Center. And Tri-Counties has been doing a lot of training on person-centered planning. And along with Redwood Coast and Golden Gate Regional Center, at our last consumer services meeting, they did an hour and a half on person-centered planning and how it relates to these CMS rules. In fact, they're going to have a training on September 14th if anybody's interested in going to Santa Barbara, not bad. But just really looking at, what does a person need? And if you need to have all those medical appointments and the medications, get that ahead of time so that you can actually sit down. And Sarah, can you pass me my water? Thanks. I've gone to several person-centered planning meetings recently, and they are really fun, but they take a while. But it's great. Like, what do you want? And everybody's part of that discussion, the parents, the aunts, the uncles, the neighbors, the friends. And it's just amazing. It's like everybody kind of says, well, I can help with that, and I can help with that. It's not just about money. It's about providing supports and services. And it's an exciting time as we're all moving towards person-centered plan. And DDS is giving us more money so we can have lower caseloads, and we can concentrate more on people and not paper. Where a person lives, that's really important. Jim talked about this already, but we have group homes, and it's like, okay, I have 6 beds, I need to have 6 people so I can pay my bills. And it's all about putting the person into the empty bed. And now this is a whole different way of looking at things. What does the person want? Do they want their own room? Do they want a backyard where they can go outside? What about a garden? And also, what about what we're going to eat? I mean, maybe we don't want to have fish sticks every night, I mean, there might be other things. I know when I lived an apartment, there were 4 girls, 2 bedrooms. We had to decide what was our menu going to be, and we worked together on it. It wasn't one person taking over. It's looking at, I mentioned earlier, your own room. Once again, DDS has given more money. If you have a 4-bed group home, you get paid more. So there's fewer people there. It's more of an individual setting, and with the extra money, our providers are able to do that. Where do you go for entertainment? This is horrible, but last week I heard, so everybody went to the movies. Well, it was a Spanish-speaking movie. The paid person that's with our consumers spoke Spanish. Did any of the consumers speak Spanish? No. Did they know what was going on? No. I mean, we don't want to hear about those things. People need to have a choice. Where do you go to worship? You need a choice. So there's a lot of changes that need to go into place. I know in our community, we met with a lot of the residential providers, and some of them are from the Philippines. And they're like, how can we do this? We've always done it this way, but there are ways to do it, and now we're trying to help each other in doing those things. There's other settings too. You can look at some of these supports. There's also adult family home agencies. Empty nesters, they have a room. Hey, come be part of our family. Supported living and independent living that Jim has talked about. And now where a person works. This is one that we've been really involved with the California Employment Consortium for Youth. Olivia Rayner out of the Tarzan Center at UCLA has had a 5-year grant that's up this October. And so we have been really working closely with a lot of people, Department of Rehab, California Department of Education, regional centers, EDD. I mean, it seems like everybody is there as we're working, how do we move towards employment? If a person wants to work, what's stopping them from working? And it starts early. It's, there's people there that represent the early start world. It starts early. And so in Orange County, we've worked really closely with our schools. Our service coordinators go to IEP meetings, and we start working on that whole mindset. It starts early. And we work with families. The family education is so important. And benefits are a really big issue if you're going to go to work. So we need to keep educating people, educating the people we serve. It's kind of like it's your mindset and your attitude. And that's something that's difficult to measure, but that makes such a difference. When I was with the Orange County Department of Education, we worked with what the districts call the most severe students, but we had wonderful teachers in our transition programs. And we had students that were out in the community training, and they ended up getting jobs. I know one young man is still at Red Robin 20 years later. But it was the attitude and the belief that with the right supports, and Regional Center needs to provide those supports if needed, and working with Department of Rehab with the right supports, people can have jobs. Now, there is a provider self-survey for our providers to help prepare for the HCBS waiver. This is 12 pages. It's on the CMS website. And so all of the 21 regional centers are getting together, and they're taking these 12 things that people need to do to assess themselves, and they're compiling it into something much simpler to help everybody get ready. Here's a deficit, and this is what you can do to get ready. And I'm so glad that Jim mentioned the $15 million, because on Tuesday, our day program providers, supported employment providers, are all going to meet, and we're going to talk about this very issue. Okay, they've got $15 million. They've challenged us. They probably won't even be able to spend it all, so we're going to work on how can we spend your money, Jim, thank you, or our money. What can we do to meet those needs? We have 2.5 years, and so we need to get there, and we're not alone. We even have money to do it, so we can prepare our providers. Daily activities, we're continuing to look at needs, but we also, in Orange County, we're looking at business advisory committees. We work with Chapman University that's helping us, reaching out to businesses, where are jobs. We've had a lot of success, and we're also looking at data, because people want to know, if you're working, show us where you're working, how much money you're making, and how many hours are you working. And then, there's also money, funds, grants that will help you even in that line. So what I've found is that when people are busy, we have decreased behaviors, we have changed attitudes when you are where you want to be. And these are two people in Orange County that are working. You might recognize one of them as she got an what's this, an Emmy, I believe? Is that what she got? For Glee. But they're working, and they're working where they want to work, and they're making competitive employment and competitive wages and integrated employment. Now, as you look at challenges and opportunities, well, yeah, challenges might look a little bit longer, but it's nothing that we can't overcome. The challenges are often it's doing business the same way we've always done business, but we need to relook at it and kind of reset our default on our computer to where it needs to be. We found that, sometimes family members saying, oh, it's much safer in a segregated environment, but you have to remember in a workshop, which our providers agreed to, we have no more referrals to our workshops as of 2 years ago, and our providers agreed to that. And so we're looking at other options. But sometimes people feel like a workshop's safe. And when you have a 1 to 12 or a 1 to 25 ratio, and you can't even go in the community, is that really the best environment or the safest environment for someone with a disability or even without a disability? So we are, also, there's people that help you with all the benefits. You see that down here at the bottom too. There's the work incentives and planning assistance. It's available free, help you with the benefits. And all those opportunities that you see. I feel like I have seen so many changes in people's lives. And I just want to kind of close with a story of Travis. We have a project, worked with Project Search with one of our school districts, and there was a young man named Travis with autism, severe autism. His mother was told when he was 4, he will never talk. Don't really have expectations for Travis. Well, Travis now works at a heart valve company called Medtronic. He works in the HR department. He probably makes more than the staff that supports him, which Sarah might talk about, I don't know. But he is doing great because he is busy. And if behaviors start coming up, they have a little walking path outside Medtronic. So Travis takes a break, he takes a walk, he comes back, and he inputs data. And he has the best accuracy rate of anybody else. So we can never give up. We can never give up on the people that we're supporting. It's just amazing what people can do when you believe in them and you give them opportunities. And this is the time to make a change for the better. And Sarah is going to show you how that can happen in San Francisco. And actually, Sarah speaks all over the United States. But exciting times for us all. Remember, the opportunities may look shorter, but they far outweigh those challenges. Thanks for the water.
Right, I get the fun part. I get to talk about what services can look like if they are person-centered and if they are community-based. Always figure. One of the things that I like to start with is my program is a program in San Francisco, and it's called WorkLink, and it's a program of Transcend Inc., and we've been doing this for 20 years now. And we started with the idea that we wanted to implement best practice, and we were going to do that. And we have been looking at ways to kind of improve and to put people on a pathway to employment and to make services person-centered and dependent on what the individuals want and what their needs are. And for the first time now, I feel like this wave is finally coming and everybody else is getting the picture. So, and I'm really excited because we've been doing this for 20 years and we have some great tools and strategies. So we're out now sharing these tools and strategies with program providers and helping other people to create services. So I wanted to spend the last few minutes kind of showing you what services can look like and what the purpose of these community-based waivers really is about. I think Jim and Janis really set the stage. These waivers were created to take people out of institutions and get them integrated into their communities. And what they turned into was a way to fund the old system and a way to really kind of keep people in programs. One of the programs I was working with talked about how it was like 12th grade forever. They never graduated, and it was, they were going to a school, the bell rang, they went, that people were telling them what to do every minute of their day. And what we want to do is get away from that. And we now have the tools and strategies to really do that. We have, there's a big emphasis now on partnerships in transition. There's a big emphasis on community-based programming and systematic instruction. And there's wonderful methods of placement called customized employment that are really helping people to get jobs that really fit like a glove. So I'm going to talk a little bit about that today. The other thing that we're getting families who are no longer satisfied with services in a facility-based setting. They don't want their sons or daughters cloistered in a building in an industrial park in the middle of nowhere. They don't want them riding buses for hours to get there and back home. They want them to have a village of support. They want them to be integrated in a meaningful way into their communities and in their neighborhoods. So that's the purpose of these waivers, and providers need to start seeing that and start responding to that. And I think with the Employment First initiatives that we're seeing in the states, and including California, and these CMS regulations and the guidelines, there is a real push for integration and inclusion, and we can really leverage this for change. So how do we use the CMS waiver services to really help people with intellectual and developmental disabilities to become active, productive members of their communities? Well, we have to start first by kind of looking at, what do people want in life? And, this may seem a little obvious. It's what we all want, right? It's employment for many different reasons. For one is for money, but the other one is that self-worth and that dignity that comes from being valued and being productive in your community. The other thing is, they want to be engaged. They want family and friends around them. They don't want to be isolated in any way, shape, or form. They want a home that feels like a sanctuary, not just a room that they've been given. So one of the things that we do with our services is we actually go in and help people to paint their room purple and put pictures up and to plant a garden, to get a cat, whatever it is that's going to make that feel like their house. Health, obviously, is a really important thing. It's hard to be out in the community if you aren't healthy. So one of the things that we truly focus on in our program is helping people to be healthy and to make healthy choices around nutrition, and also to work out at a gym. All of those things are really critical. One of the other things is that independence in choice and options. Nobody likes to have their mother with them their entire lives. I can attest to that. We want to make decisions, and it was really interesting to hear that supported decision-making versus conservatorship discussion this morning. I was really pleased to hear that. And I think that is the direction we need to go. We need to give people control over their lives, and it's really imperative that we as providers and as case managers and as families start that young and really build that. So freedom and independence and the ability to make mistakes and learn from that is one of the things that we strongly believe in at WorkLink. And then what happens is people have meaningful lives. And they get out there and they have friends, and they really are connected to their neighborhoods, to the we have this one young woman who we refer to as the mayor of the mission, and she literally walks down the street and waves to everybody she knows, and it's really quite fun, and that didn't happen overnight. And in fact, when we talked to her mother about her being independent, her mother was like, not in this neighborhood. And so we started working with her on, getting to know everybody in the taqueria, everybody in the dollar store, and we started, teaching her to take the bus and teaching her to be independent. And then she started seeing herself as independent and started advocating that with her, with her family. Of course, her mother said no, no possible way, even still. And so we videotaped her. And one day I was kind of hiding in the bushes, videotaping her to show her mom that she could do this and that she was very, very independent. And she lives in a pretty rough neighborhood. And she was sitting at a bus stop, and up walks a man who was a little intoxicated or something else. And he was bothering her, and I'm filming her, and I'm like, oh, and I was just about to slip my little camera phone in my pocket and go help her, and out from the dollar store, out from the taqueria, comes all of her neighborhood friends. You get away from her, you get away from, they ran the guy off, so I'm filming it all, and I showed her mother, and I said, you don't have to be afraid, your daughter has her village, and she said, you're right, go. And her daughter now goes across the entire city. She takes the bus to her brother's house. She's taken the train to Sacramento to see her other brother. She's going all over the place, and she feels very independent and in control of her own life. And that's what we want. That's what services, and that's what the purpose of these waivers are all about, is to get people into the community and build those villages so that they can be independent. So how do you do that? The first part is to really help people who have not been in the community to get out and do that. So exploring, discovery, getting out and verifying what their interests are and what they're good at. There's a lot of people who haven't had a lot of opportunity to try things. So one of the first things that we do with people is take them out and show them what are their options, what can you do, what are the really great things that you're good at. And to really encourage the idea of work. Many people have had experiences either just doing janitorial work, or maybe they worked in a sheltered workshop for 1,000,000 years putting together widgets. And when you say to them, do you want to work? They say, no, I've done that, I don't like that. And it's what they know. The only thing they know that work is making widgets or janitorial work. So what we do is really take them out and say, there's 1,000,000 other things that qualify as work and you can get paid for. And what do those look like? The other thing that we look at is really strengthening employability skills. So building that motivation, that work ethic, and the hard and soft skills that go along with that. We build community, and again, addressing those non-work needs. One of the young women in the program, we went on, when we first started, the only thing that we offered was supported employment services, so only work services, because that's what we were all about, and that's what was really important, or that's what we thought. And what we realized is that's only half of your life. So what we soon found out is we would put, we hung a shingle, come, everybody come, we'll get you jobs in the community. And nobody, and especially people with more significant disabilities, said, no way, that it's not an option for my son or daughter. What are they going to, they're not going to work full time. So what are they going to do? They're going to sit home for the rest of their week. They're not going to, we've got this house of cards built. How do we deal with the work piece when a schedule is not going to be the same every week? Or, we just can't, we can't manage that. So what we soon saw was that it takes more than one type of service. So one of the things that we did was we started braiding in these community-based waivers so that we could support those non-work needs. And we started using a Department of Rehab supported employment services to address the work needs. And it allowed us to really get at creating wraparound comprehensive services for people so that they could be in the community safely and that they could be participating in a valued way by working. And it was a way to keep them connected. That young woman who we put in a job, we wrecked her life. She literally lost contact with every one of her friends. She did not initiate going out. She did not, and that wasn't a service we provided, so we were just like, it's not what we do. And she was miserable, and it came to work. The only place she got out was to go to work, and she went to work every afternoon for 3 hours, and that was it. And she went to work, and she partied. She was playing around. She was talking to everybody, because it was her only social out. And she's a very gregarious person, and yet she didn't initiate getting together with her friends. And so we decided at that point that we needed to use these community-based waivers to really get her connected and to get her support around those aspects of her life. So we braided those in, and it really does make a big difference. So those community-based services, we can really explore their interests again. As I said, we can develop social and professional networks that we can use for employment opportunities. We can teach them independence and self-reliance and self-confidence out in the community. They can learn hard and soft skills. And then as those natural supports, as those villages build, we can fade those supports. So we see those community-based waivers not as a lifetime sentence and a lifetime program, but as something that's going to fade back as a person gains skills. Some people may never get to the point of being independent, completely independent in the community. Some people will never cross the street safely. Some people have support issues medically, et cetera. Those people we can support using our program model as well. And what we do is we balance our program model so that a third of the people in the program have more significant needs, support needs, a third have moderate support needs, and a third are just needing a little support to get off the ground, and then they're off and running. So it allows us to really tailor services around what the person's needs are. A big component of the program is really adding value and volunteering, because when you get out and you're doing something that really, this is not about supported loitering. We do not go out to the park. We do not just sit in the mall. We go out and we do things that are meaningful and that are purposeful and that are determined by the individual. It is not dictated by what my community instructors have dreamed up. It is based on what that person's goal is and where can we teach that in the community. A big part of it is adding value, and a big piece of this is because we want the community to see people with disabilities in a different light as well, not as always being helped, but being helpers. So, and for them to see themselves as helpers too. So they go from helpless to helpers. And it really is amazing to kind of see what that does to their entire personality and also to the community at large. So it's a new approach to day programming. The waivers really kind of create, like I said, that wraparound service. We can really tie that into supported employment services and provide a level of support. Our program is 100% community-based. People go from their homes to wherever they're going. We don't want them reliant on WorkLink, and if we pick them up and drive them there every day, the only time they're going to go is if we pick them up and drive them. So we want to teach them to go by themselves. We want to teach them to be independent and to rely on their friends too. We have people who can't travel independently, and we teach them to kind of go to their friends' houses and pick up their friends and then go as a group in some instances. So teaching them to be good friends is another big piece of it. We focus on creating a pathway to employment and really kind of building those skills. So again, 70% of it is in volunteer jobs at nonprofits throughout the city. We also have a project search program, which has really been instrumental we kind of refer to it as boot camp. And it is to really kind of ratchet up the bar a little bit if people want to work in a professional setting and have never done that, or they want to work 20 to 40 hours. It gives them an opportunity to really feel what 20 hours feels like, and it's really a professional environment. The job tasks are meaty. It really gives them a good work internship experience. And it also gives them letters of reference and professional contacts that we can then leverage for employment purposes. And we have taken people out of that program and found them just amazing jobs that pay twice as much as my staff are getting. They don't want to talk about that, but. And it's an individualized, person-centered program, very small ratios, 1:3, 1:4 max. I talked a little bit about the heterogeneously grouping that. A third of the people have significant disabilities, a third have moderate. You cannot run a program like this if everybody in the program is medically fragile and needs a huge amount of support. You cannot get all of those people out in the community. If everyone is in a wheelchair that has to be pushed, how do you get multiple people out into the community? So we have to look at breaking that up and making sure that those people. When I was talking to a program about this, they said, what we've really done is we've segregated those people not once but twice. They couldn't even get into that program, so we put them over here in this program. And that's true, and you see that. There's a lot of lumping people with the most significant disabilities in a program. And then, how do you deal with that in an individualized, person-centered way when you have so many people with such needs. So what we do is, what we see working really, really well is spreading it across a number of programs and spreading it across a number of, if you heterogeneously group the programs, you can address the needs of everyone. And we usually stagger start the new sites, so the people who have moderate and who are a little more independent and have like more moderate needs start first. We get them kind of rolling, and then we bring in the person who needs door-to-door transportation and one-on-one kind of support and assistance to partially participate. It's goal-oriented. Again, it is not determined, again, by the community instructor, or, they don't walk in and we don't have 3 things up on the wall. What do you want to do today? Obviously people with transitional issues that would just light their hair on fire if they had to go in every day and figure out what I'm going to do today. So what we do is we give them weekly schedules that are written in stone and it's based on what's written in their ISP and in their goals. This is what they need to learn. Where can we teach that? That goes into their schedule. Schedules are built and kind of built to order. None of them look the same. Some people come once or twice a week because they're working, and all they want to do is go to the gym and see their friends once or twice a week. Other people come on a daily basis because we're doing that discovery and that exploration, and they're not employed at this point. So none of the schedules look exactly the same. But what they all look like, they are all meaningful. They are all based on the person, and the person has input into everything that they're doing. And they can come and tell us, Sarah, I'm not doing that. I don't like doing that. And we will figure out what else they can do, or do they want to come to service? I mean, it is not a Monday through Friday 9 to 3 thing. I don't go out into the community to be out in the community. I mean, we have to stop looking at this as we're going out into the community to check the box and say that we were out in the community. That's not the purpose of going out into the community. So we have to kind of look at how can we create lives that are normal? How can we normalize this? And use our services in a way to really build meaningful villages for the people that we're working with. So Anna, this is the young woman who actually ended up losing her job because she was socializing. She taught us everything we know. We went and got those community-based waivers because of this young woman. And she is now reemployed. She's earning $12.53 an hour and has stock options at the Gap. She's working 9 hours a week, which is as much as she wants. We tried to get her to go up a little bit, and she said no, because she likes what else she's doing. So she's learning to cook. One of the things she's going to do now is move out of her house. So she's learning to cook at Project Open Hand once a week. She loves to swim, so we built in an opportunity for her to go swimming. She can dance like you cannot believe. So one of the things that we put her in was Zumba. She volunteers at Save the Redwoods. Again, she's traveling all over the community. She is the mayor of the mission. And she loves to meet up with her friend Danny on Saturdays, and they go to Japantown to sing karaoke songs. So the discovery process is the first step. Again, this is what we're really looking at, is building a profile of someone so that we can create a meaningful life and really target employment opportunities. So with discovery, again, it is not a question of if a person can work, but where. What can they do? It's not about can a person work. It's where should this person work. And one of the things that we like to do is to really kind of explore and verify interests. We get a few people who have been told things, or they've tried it once, or they saw a picture, and they come in and say, I want to do that. And then we find out that, lo and behold, they don't really like it. So this young woman said she really likes babies when she came in, and so we set up a volunteer experience in a small group. There was a group going to the YMCA that also had a child care opportunity, or center. And so she went to the child care center while Anna was doing Zumba and someone else, so there was a small group of people, but they were dispersed across the YMCA, and the community instructor was there to kind of monitor the activities and support everyone there. She was volunteering in the child care center, and we brought in a job coach for a few weeks to kind of get her rolling and get it started and get her up to speed, and then she was there with the support of just the community instructor. Lo and behold, she didn't like babies as much as she thought, because they cry, they don't listen, was one of the things she said. And then there's that diaper part. So, but that was good information for us, because we have been burned a number of times. I tell this story all the time. We had a guy that, came out and we said, what do you want to do? And he said, I want to work in a garden center. And we were like, oh, slam dunk, easy, garden center job, we can get that. We ran out, put him in a garden center job, and 15 minutes into his first day, the job coach called and said, this isn't going to work. And I, of course, was like, Randy, you are the job coach, get out, you have to, he doesn't like dirt. And he didn't like the heat, didn't like the dirt. And Randy's like, he found out what was in manure bags. He won't touch them. So we brought him back in and we said, what? You said you wanted to work at a garden center. And this is where informed choice comes in. And we said, what made you think that was something, why? And he said, my teacher told me I would be good at it. And that got stuck in his head, and that's what came out of his mouth. And so now we don't get burned by that anymore. We take them out and we look at, do you know what you're saying and what this looks like, and let's go try this. So we have a garden center now that if someone comes out and says, I want to do landscaping or gardening, look at this, it's dirty, it's hot. It's, you have wheelbarrows that you have to put. So, it's an opportunity for them to really try things. So kind of strengthening that employability and independence is the other piece of it. So we look at what else do people need to learn, the hard and soft skills around employment. So we teach the hard skills, so how to drive a wheelchair safely and not bang into cubicles, or to cross a street using the cutouts safely, or even how to cross a street. Using a knife, buttoning a shirt, peeling a potato, all of those things are things that we're working on. Crossing a street, brushing hair, washing hair, that's a big one. Telling time, money skills, math and reading, all of these things we work on. But the big thing that we really stress and what we really focus on is the soft skills, because 85% of employers surveyed said soft skills, not technical skills, were the critical factor in job success. So what does that look like? Everything from generalizing skills, making judgments, problem solving. Our community instructors are taught to go from being teachers to screwing things up. So when the person finally knows how to do things, and they're really getting good at it, then the community instructors change hats and start screwing things up. They start making them run out of things. They start jamming the copier. They start, making them late, things like that. Or, here's the good one. Remember the young woman whose mother wouldn't who wouldn't let her go, because when we got to the point where we're like, she knows this, she's got this, she's really got this. Her mother said, well, what if she gets lost? So one of the things that we do is we take them out and get them lost. We take them out the wrong BART exit. We miss the BART stop and go all the way to Lafayette. And we say, oh my God, we're in Lafayette, now what do we do? And they have to figure out how to get home, how to text someone, how to call someone, how to walk up to someone and show them a piece of paper that says, I'm lost, help me. So those are the things that we're working on, is that whole problem solving, taking initiative, work ethic, motivation, language, interacting with others, manners, problem solving, as I said. And a big part of our services, as I made clear with Anna, the mayor of the mission, is really about building community and really connecting people to friends and society. Because what we're really looking at is the waiver talks about integration, but I don't think that goes far enough. What I want to see is, I don't want to see people standing next to people. I want to see people interacting with people, and included. And that is one of the things that we say is that really takes repeated experiences. You cannot go into some place and get to know somebody and feel included if you show up at a place once. So we do not do field trips. We don't do supported loitering, and we don't do field trips. Because you go out, you see something, you leave. You never go back. You don't get a real opportunity to interact in a meaningful way and to understand what this feels like. The other thing too is we're working with people with intellectual and cognitive disabilities. They do not learn quickly in some instances. They need repeated practice. They need to understand what's going on and what's happening before they can actually integrate that into their minds and into their actions. So taking them once, they're overwhelmed. They don't know what's going on. They don't know what's expected. So if you go once or twice or 3 times or 4 times or a month, then they start to get it and they start to understand this is how this works. This is what's expected. This is Debbie. And I can make friends with Debbie, and Debbie knows my name now. So they can practice those social skills. They can really become comfortable, and they can really see if it is indeed something they liked. Like that young woman who said she liked babies. She liked being around them, but the second she had to kind of work with them, it made her very anxious, made her very nervous. And until she had that opportunity to actually interact and engage with babies on a routine basis, she didn't really know that. She didn't understand that. So it's more than just going out and buying a cup of coffee. You have to be engaged and you have to be in meaningful ways. And that having that opportunity to really give back is really critical. So one of the other things that we do at WorkLink is we use customized employment, and it's a really strong tool. It's kind of the silver bullet. And it allows us to develop jobs based on people's strengths, not on their deficits. I like using this. How many people have ever seen a job that says this? Company looking for an individual with developmental disability, cerebral palsy, autism, history of aggressive behaviors, auditory processing delays, lack of visual motor integration, extensive history of hospitalization, preferred drug addiction, poor social skills, delusional behaviors, okay. Movie day on Friday, call for an application. You don't see this. Yet we as social service, and unfortunately people with disabilities have been in this medical model since day one. They have to prove they're disabled in order to get services. Social Security, special ed, regional center services, they have to prove they can get, that they're disabled to get these services. And this is how they learn to see themselves, and this is how they learn to talk about themselves. And unfortunately, we have to really reframe, because there aren't jobs like this. And we have to stop talking about people like this. And so the first thing we start to do is kind of really reframe. So when you look at it, this is exactly what you see in someone's file, is all of that crap. All of the stuff that's broken, all of the stuff that needs to be fixed. And it gets you nowhere, because there aren't jobs for that Roy. Roy, who has autism, hyperactivity, intellectual developmental disabilities, can't sit still, can't focus, bombed out of like 3 programs. We said, okay, we got to figure out what Roy's all about and really figure out what he's good at. And this is where the discovery process really kicks in. So we figured it out. He's really a physical guy, and he has to be active. He cannot sit still. He's like a tornado. And so, you know, he has to be moving. He's very, very outgoing, very gregarious, talks endlessly, right? Has to move. Hates getting up in the morning. That was one thing that was very, very clear. Decked his job coach, because he was in a job where he was working at 6 in the morning, and his job coach was always nagging him because he was always late and didn't work out real well. But he loves variety. He loves to move, loves all that stuff. Can match numbers and words. Yes, he might not be able to read, but he can match and use sight words. He's opinionated, very passionate, is what we said. Here's the keys to the kingdom. He's a gearhead. He loves expensive cars. This came out in his person-centered planning. It was not in his file. It was nowhere ever in any report. Nothing ever said anything about the fact that he knew everything about cars. And not just any cars. He loved expensive cars, really expensive cars. So Maseratis, Ferraris, Maybachs, Bentleys, Morgans, like those were what he was all about. So, is there a job for this, Roy? Yes, there is. Are there jobs for physical jobs that require you that are connected with cars? So we do in our organization. We have but anyway, so instead of dreams, he wanted to work downtown. Roy wanted to work with cars. He wanted to work with cars. So if you look at, what that would look like, and what we look for is kind of the center of the bullseye, where those things overlap. So with Roy, one of his bends was cars, and he had to move. Something that was people-oriented. And then what we were looking for was where do those overlap? And if you start really looking at, there are jobs out there. There are jobs for that, Roy, and there are jobs where cars and having to move, it automatically starts taking you down the right road, right? So here's a guy that bombed out of three programs and decked his job coach, just really wasn't motivated, didn't want to work. He's Employee of the Year at the Divisadero Car Wash. And it wasn't just a car wash, because he wasn't interested in Toyotas or anything like that. It was I was like, that's not going to be a good spot for him, a car wash. And the guys, one of the job coaches said, oh yeah, no, this is going to be perfect. It's right down the hill from Pacific Heights. He said, I took my Toyota there, and he said, I felt out of place. It's a really expensive car wash. It's all filled with chauffeurs. The Getty chauffeur is there. And I'm sitting there with my little rice bucket, kind of like, and they're like, whose Accord is this? And he's like, So they went. It was like Disneyland. Roy had never seen anything like this in his life. There were Ferraris, there were Maseratis, there were, and he's like running from one to the other, and the job coach is saying, no, don't touch him, just looking. And over walks this man and says, can I help you? And it's, and he's the owner, because this guy's running around like getting really excited about what he's seen. And the community instructor said, oh, Roy's a gearhead, really likes cars. And he said, so am I. And he walked up to Roy and he said, hey, and Roy said, and he said, what do you think about that one? Oh, see, I wander too much. What do you think about that one? And then Roy starts on how big the engine is, how many, blah, 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 blah. And he said, hey, have you ever seen a DeLorean? There's a DeLorean in the back. So you want to go sit in it? So he goes, and it's one of those, and so Roy gets to sit in the DeLorean, and the man, comes back over with him after they go sit in the DeLorean, and God bless my community instructor. He says, Roy's looking for a job, and this, he would love to work at a place like this, obviously. And the guy said, well, to Roy, do you drive? And Roy, he doesn't, and he never will. And so the community instructor said, when we walked in here, there was a log jams, and the man said, well, everybody here drives. We assign someone a car, they drive it from one section to the other, and kind of make sure that it's going from one section to the other, and they're responsible, it kind of moves as a team. And so, that's how we work. And God bless my community instructor. He said, well, when we came in, there were a whole bunch of cars over there waiting because there was no one to drive them. What if you had Roy bounce between the different stations, and wherever they log jammed, he would follow that kind of bubble, and he would help kind of keep things moving. And so he hired him, and Roy's job was to run from one piece of the car wash to the other, which was great for his disability. He was touching cars and taping them and washing them and drying them and waxing them. And the owner called back about 6 months later and said, he's lapping these guys that have been here forever. And he said, I'm making him Employee of the Year. And he said, does he have any siblings that want a job? So it works. And it works really well. We can get all sorts of jobs for people by giving them training and support, and really focusing on who they are and what they're all about. And we often hear we're not hiring. It often goes when we start showing employers how people can benefit their business. It often goes from we're not hiring to when can they start. And we often hear they're one of us. They belong here. This is Simon. He's He's a young man with autism who went through our Project Search program. In fact, well, here's his pathway. When he first came out of school, he was a jumper, a flapper, and had no language. He spoke in like single word sentences. If you were lucky, you could get a single word out of him. And so we started him in volunteer jobs, and nobody knew what he could do. The teachers had him sweeping at Lowe's, and that was it, and he didn't really like that. And he kept saying downtown. That was the one word we kept getting, downtown, Embarcadero 3. And so we were like, well, he's never worked in a professional setting, so what do we do? So we put him through the Kaiser program, and he went into the material management section and just aced it. And the material management department gave him kind of this pulling expired medicines job in the central distribution area, and it was a huge place with millions of items, and they were getting a JCO review, and the manager said, we need to make sure that there's nothing on the shelves that's expired, because they'll ding us. And he said, so I need someone to go through, and he said it'll take him the entire internship rotation, all 8 weeks of it. 2 weeks later, Simon was done, and there were 8 bags of stuff that he had pulled off the shelves. So the manager comes in, and what do you think the manager says? There are catheters in there. There's some things that are really expensive. He said, if those things are not expired, I can't just throw that away. This is way too fast, way too fast. He said he just was pulling things and throwing them in the bag. So the job coach says, well, I'll go through. 100% accuracy in every one of the bags, everything in those bags. So what do you think the manager said then? He must have left something on the shelves. He must have skipped shelves, because there's no way he could have done it this fast. So the job coach is like, I'll go through every shelf. So 100%, nothing left. It took the job coach the rest of the internship rotation to go through the shelves. Nothing left on the shelves that was not expired. So what do you think the manager said then? He said, I'm going to the union. I'm going to create a job for this guy. I'm gonna, and so he was going to go start, was talking to the union about starting, we were like all excited. Oh, he's going to work for Kaiser. He's going to go, And so we do you want to work for Kaiser? And and we were like, what? What? And downtown. Embarcadero 3, not 1, not 2, not 4, but 3, and we were like, what is there? So we took him down and we're like, what is in Embarcadero 3? So we went back to the manager at Kaiser and said, he doesn't want your stinking job, in a nice way, and we took him downtown, and we were like, okay, well, Simon, if you're going to work down here, you have to dress like these people. The other thing that we really worked with him on was polishing his social skills, because he had very limited language. We gave him some phrases. So they were teaching him phrases. So the best one was, ladies first. Hold the door, hold the elevator, ladies first. So he would bust that out in Kaiser and help hold the door, and ladies would go on first. And so we went down in Embarcadero 3. We worked on his hygiene. We worked on dressing. We took him downtown for lunch. Look at how they dress. They have button-down shirts. They brush their hair. They wash their hair. And we worked on all of those things with him. And we finally get him into the, and he has these, he's got letters of reference from that manager saying he's amazing. He's an incredible machine at filing and other things. So we went to Embarcadero 3, lo and behold, it's stuffed with lawyers and law firms. So we went in and approached one that we kind of networked our way in, and it was PSA, and the woman, it wasn't going well. We brought him in. Of course, he has significant autism, and she was giving us we'll get to this. Yeah, I'll talk at the staff meeting, and we'll call you back. And so she was pretty much, and I was like, ugh. So I said, will you show us around? Will you show us the filings? So she said, sure. We're, kind of taking us around. We're Walmart lawyers. We do Walmart filing. She opens the drawer, and she said, so it's just the person's name and and shoo, Simon pulls out a file and says, mistake, and hands it to her. It was State Farm. It was in the wrong drawer. And she was like, oh, so she starts seeing that, indeed he's, and then he busted out the ladies first when we were walking. And she looked at me and she said, these lawyers could learn something from this young man. He's now working there. He was at 18 hours. He's now at 25. They just hired him to work with some lawyers on a case that came back, and it's his job to put 7 boxes of emails in order, and that'll take him a minute.
Can we do questions real quick?
Yes. So we're done.
I actually have a couple comments, and that is, I think all the presentations were wonderful. However, there are significant numbers of individuals that are not being served. All these programs are wonderful. They don't work for everybody. And those individuals are, after age 22, are basically receiving adult babysitting that the state of California is paying for. So they meet in a park in the morning and they wander around and they're not doing it, and the people that run the programs talk till they're blue in the face about all the things that Sarah's company is doing. But what ends up happening is nothing. I just want to make the point that everything that everybody's talked about is great, but there are people that have the potential for behavior issues that can still work, as Sarah pointed out in some of her examples, et cetera, that are not being provided with services. And there's a lot of cherry picking going on in many of the programs. They pick and choose who they want to serve. And the last thing I want to say is day program, in many cases, is a misnomer. It doesn't take up the day, and it's not a program. And there needs to be a lot of work and changes, because the other word besides employment, and Sarah touched on this, is meaningful engagement, whatever that is for the individual. So I just want to make that point.
Response?
Agreed.
Yeah.
What do we do about it?
There,
That's the open session.
Jim, would you like to? Sure. Thank you.
I like the term, well, I actually don't like the term, but they used about, was it supported loitering? Yeah. Certainly, that's not what we're after. And this is, I also mentioned it too, that it's kind of, it's unfortunate but fortunate that we've had to add some federal rules that is going to push us in this direction, but it's fortunate in a way that it gives us the opportunity to take a look at things that we don't like now and to try and move those forward and do some changes. So this is the time to really interact and engage with folks on making sure that, hey, this is how services we really want them to look. There is some funding available now, but we need some more ideas about how then we want to go forward with that.
Just to add one more thing from a regional center perspective, I mean, we do hear those things, and it saddens us, but we are looking at quality assurance, more quality assurance people going out there, making those observations, holding those people accountable. But you're absolutely right, it does happen, and we would like to address it more.
Well, the providers say they're not getting enough money to run their program.
But there is more money now. There is more money now.
That's what's changing. But again, what the services are going to look like is going to be very different for those individuals. It's not going to be independent. It's going to be more self-reliance. And can they brush their own hair? Can they feed themselves? Can they drive a chair? Can they communicate with pictures or whatever? So it is you do, in order to do it safely and to build stamina and all of that stuff, it's going to have to start out more slowly, and it's going to have to grow. So it will look different.
One of the things I'd like to just point out is in Sarah's presentation, the number of things that were generic services, you used the open hand. There were so many things that people were doing that were not specific programs for people with disabilities. I'd like to move on.
It's all community resources.
So I had a question about the employer side of things, because I know the focus is right now a lot on how to get providers to provide a lot of really incredible services. And Sarah, your program is amazing in terms of how many people it sounds like you've gotten to be employed. I'm just wondering, both on the state and national level, is there, what is being done to focus on getting employers to hire in terms of either in, tax incentives or campaigns, and I'm particularly interested in small employers. Is anything happening on that front? I just don't know.
One of the things that we're really trying to change is this is not about encouraging employers to hire people with disabilities. They know they're out there, and what we have to do is do the translation, because employers do not know what that specific person, they did not know what Roy could do for their business. And it takes us to do that translation and to show them. And that's what we need to teach providers, is to show employers how that specific individual can benefit that specific business, because hiring is a business decision. It's not a social issue. It's not charity. So it has to make business sense. And unfortunately, a lot of providers are not trained in business principles or business approaching businesses. They're just going out there with their charity little social service hat on. And which is why I worry. Yeah. No, so we're trying to change that. The organization that I work with does a lot of training around employer engagement.
Right. And then I'd also like to point out that there are programs like the BAC that you mentioned. We have one in our local area that is working with the community, the business community as a whole, to understand that there are projects that support people with disabilities.
I think it's extremely important to note that whether you're an advocate or a parent or a conservator, you don't just stop at looking at one program. When it came time to look for a program for my son, the representative from the regional center and my son and myself, we toured a whole bunch of different programs. And some of them I wouldn't leave my dog with. But you don't stop. If you're going to be associated with a special needs person, you need to dismantle reverse out of your gearbox. Because if you back up, who's going to stand up for that individual? And so you look at the next program, and the next one, and the next one. And if the one that you select isn't quite up to snuff, step in on them, lean on them, push them, be involved in the program. See if you can make some changes from within. If not, menacing always helps, because ultimately it's the future of that individual that it's all about. And if you're not part of that solution, that
Right.
problem will continue.
Never settle.
One of the issues we come across with clients who want to be employed but maybe live at home with their families is that the family is sometimes dependent on the Social Security that the individual brings to the table and doesn't want that individual to work outside of the home. And our clients that we're serving don't necessarily want to go against what their parents want. And so we're really trying to teach that when you're working, you'll still bring in more money, but then how do you distribute that money amongst the household? And we're really struggling to find resources in our communities that can help explain this to families. Do you have any ideas or suggestions?
You want me to take it? Well, what you're talking about is benefits planners. You do not dabble in benefits counseling if you don't know what you're doing. And there are some resources out there. The Social Security Administration realizes this, and across the country we realize this. This is a big barrier for people going. And there are a number of states doing some really wonderful things. In Virginia, the Department of Rehabilitation is now funding benefits counseling, and they are funding providers to get that training, and then they're allowing providers to bill for that service. So they suddenly, in Virginia, have lots of benefits counselors available. So this is what needs to happen, is we have to incentivize providers to actually get that service, and in order to provide it. So, there are ways. And the other thing that we need to focus on is financial literacy for these folks. And we need to help them to understand that, when you work, it's tied to making money and changing lives. And there's reasons to work besides making money. It's that friendship, it's that being valued, it's that dignity that comes from being employed. And we have to have families understand that, sitting home and collecting a Social Security check is not the best path.
The UC Davis Mind Institute was created in 1998 with a promise to find cures for neurodevelopmental disorders. Every day, our physicians and researchers come closer to fulfilling that promise. Their groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other brain disorders are helping children achieve their fullest potential. Please visit our website to find out more about current studies, upcoming events, and how you can help make a difference.